Some would say she went from the frying pan to the fire. Trauma had a huge impact on her, and what she did about it, coming up on the Law Enforcement Talk Radio Show. Welcome to the Law Enforcement Talk Radio Show. In the Law Enforcement Talk Radio Show, we are joined by special guests talking about their experiences, the realities of investigating crimes, plus those who have experienced horrendous trauma. Police, first responders, military, and victims of crime share their stories. Hi, I'm John J. Wiley. In addition to being a broadcaster, I'm also a retired police sergeant. Be sure to check out our website, letradio.com, and also like us on Facebook. Search for the Law Enforcement Talk Radio Show. There's a couple ways you can stay in touch and keep informed of what's going on with the Law Enforcement Talk Radio Show. Number one, go to our website, letradio.com. Sign up for our email newsletter. It's real easy to find. I promise we don't spam you. I send out about one email every 2 weeks or so. And there's also a feature called Broadcast Channels on our Facebook page, where we send messages directly to your inbox, directly to your messenger. Real easy to sign up for. Make sure you like or follow the Law Enforcement Talk Radio Show Facebook page. And up top, you'll see broadcast channels, one for free podcast versions of the radio show, another one top post of the day. So you too can stay informed quickly, easily, and best of all, like always, free. Joining us on the phone from Colorado, we have Laura Boblitz on the Law Enforcement Talk Radio Show. Laura is a retired registered nurse, retired RN. She worked in jails. I know. It's just instinct choice, and we'll talk about what prompted that a little bit. She is now a life coach, and her business is 3R Strategic Life Coaching. Website is 3rstrategiccoaching.com. The 3rstrategiccoaching.com. Laura, thanks for your service. We love our registered nurses. I do. I really, really do. And thanks for being a guest on Law Enforcement Talk Radio Show. Both very much appreciated.
Wonderful. I'm glad to be here.
It's good to have you here. I got to ask this. You're a retired RN, and my first wife was a registered nurse. She was the emergency room nurse in Johns Hopkins in Baltimore. And to say that she is as salty as I am, retired police, would be an understatement. Would you describe yourself as salty?
Pretty much, yes.
Yeah, I don't have a whole lot of chill in me when it comes to people's nonsense anymore. And drama and trauma and who struck John and he said, she said, I really have no chill with whatsoever.
Mm-hmm.
Is that a fair assessment for you?
I understand that. Yes, I don't have a whole lot of patience. So that kind of what I became, what I'm working on right now, that is part of what drove me to doing what I'm currently trying to do.
I just had a conversation with a friend of mine before I came on the air, and not to go into his story, but it's like, here's what I told him. I said, when life gets really challenging, especially older I get, and his situation is challenging, sometimes I have a tendency to want to react and do something. And sometimes the best decision I can make is the decision not to do anything at all, because I can literally jump from the frying pan into the fire and make things much worse.
I understand that too, very much.
So you didn't start off light as an RN. What prompted you to do that?
I started as an LPN and then rose up the ranks for my associate degree and my bachelor's degree. And I was working in nursing homes, and my mother was working for a county jail, and all of a sudden all the nurses left. And she's like, why don't you go apply? I'm like, oh, I don't know about that. I was only 3 months in to my nursing career, but I went, and the benefits were just amazing, especially with 2 small children. I just had to do it. And then it became what I wanted to do, advocating for the patients. And I did some programs through my bachelor's for my capstone course that were related to the jail as well, for discharge planning and making sure that the patients that were on medications before they left the jail understood their meds and what they were supposed to do, because we had some adverse events of them leaving without any of that information.
Right.
And one patient actually died before he even got to the bus stop.
Right.
So you learn those things along the way. And I ended up being in charge before I even had my RN, because of our staffing was so limited.
Well, that's a good way of putting it. We say, you said earlier in the conversation that you presented with these life changes and occupation changes, and you got your RN, all that stuff, and someone said apply to a jail because everybody left. Was that a clue to you? It
was a clue, but with 2 young kids and a husband that was having a hard time working due to his medical conditions, I thought, well, I'll just go out there. If I don't qualify, then I left that to the health service administrator. I thought, what the heck? And she loved me. So Fran's like, no, absolutely. And I went. It was scary at first, but I did have very good mentors, right. I have to say, and that made all the difference in the world.
How long did you do? How many years working as an RN in jails?
28.
And after 28 years of being a registered nurse in jails, has it had a tremendous effect on you, good, bad, or indifferent, or both?
It's kind of both. You see the both sides of the world. You see, the people that are struggling off the streets, but then you also are working with your colleagues that are struggling as well with other things, their home stuff, things that are going on within their little cliques in the facility. And that kind of why I decided I wanted to do some nurse coaching, because it's hard, especially for officers. There's not a lot of places for them to go to be heard in a safe and confidential space to kind of just work through some of those issues. It's right. Definitely not therapy, and it's not clinical treatment. It's just a sounding board, really, for you to talk through it, and we ask questions to get you to kind of think more about it. And the amazing piece is it's listening. I found that the listening piece is the biggest part of it, because nobody listens to anybody anymore. We're on our phones, we're doing this, we're not actually focused on somebody. And when someone is actually focused on you, listening to what you're saying, it's just another experience that some people have never had.
Right. Well, people are shocked when people actually pay attention to what they say and listen and respond to that.
Right.
And by the way, and I'm not blowing my own horn, but a lot of people ask me, well, what are the questions you're going to ask with this radio show? And I'm like, we don't have real conversations in real life like that. And most of my conversations with my guests, and we've been doing this going on almost 10 years now, that I listen to what my guest tells me, and our conversation goes from there. And you're no different. Mm-hmm. Because what happens on paper is people think, well, I got a pretty boring story. I don't really fit. And and they don't realize the power of their personal experience. And we'll get into some of that with you. You said earlier in the conversation, your husband has some health challenges and he was not able to work, and you got good benefits. Are you able to elaborate on that?
I have, I've worked for a long time dealing with a lot of his medical issues. They've just gotten worse and worse throughout the years. And part of that, too, it became a blessing that I became a nurse, because then I learned so much that I could apply to his situations and what he was dealing with, which were pretty significant.
And how old were you when these life changes came up for you? Because this was, I look at my life now, and I'm not the same guy I was when I was 20.
I started in 1993, starting my nursing experiences. My husband and I have been married since 1988. So it's been a very long time of processing through, and things just continue to kind of get worse and worse through the years. So
gotcha.
My knowledge made a big difference in, I think, his at least current outcome when I retired. He's only been in the hospital once.
We're going to take a short break on that note. We're talking with Laura Boblitz. She's a retired RN. She worked in jails, which we'll talk about in a few moments. There's reasons why, and she is now working as a strategic life coach. 3R Strategic Life Coaching is the name of her business, and it's 3rstrategiccoaching.com is the website. This is the Law Enforcement Talk Radio Show. We got more coming your way in a few moments. Don't go anywhere. We'll be right back. One of the questions I get all the time is, how can I show my support for law enforcement? We're all busy. We've got busy lives, but there's something oh so simple you can do with our Facebook page. Search for Law Enforcement Talk Radio Show Facebook page. And when you see a post you agree with that resonates with you, share it, especially episodes of the podcast. To do all that, just search for us on Facebook, look for Law Enforcement Talk Radio Show, and be sure to click like. Return conversation with Laura Bulblitz on the Law Enforcement Talk Radio Show from Colorado. She's a retired registered nurse. We talked earlier. She's a little salty, which I am as well, which comes with the territory. She worked in most of her career in jails, which had a profound impact on her. And she is now a life coach, retired nurse, a life coach. And the name of her business is 3R Strategic Life Coaching LLC. Her website is 3rstrategiccoaching.com. Laura, quick question, and I'm going to phrase this as a form of question. It's more of a personal statement. I cannot stand the noise in jail and prisons. The noise alone and the people yapping and the nonstop clatter, all that stuff would be more than I could handle. Did you have that immediate experience when you made that choice, I'm going to become a jail nurse?
In my first position, not really, because that facility actually had the inmates locked down into a pod and then locked down into their rooms unless they were out for day room time. So that wasn't too terribly daunting for me. But when I went to my other facility, it was like Alcatraz. And I was like, what did I do? And that was just chaos for me. And they let the inmates roam the halls and to come get medicine. And it was just really maybe very uncomfortable there. But it was a whole different culture of officers and the workspace. It was it was just amazing. I was like, what did I do? I even had to walk tiers to pass medications on 3 tiers with a little tray. And so that became very scary, especially when one actually put his arm out and grabbed me through the through the bars, because the officer couldn't even stand really next to us. They had to stand behind us because the tier was so small. But he, fortunately for me, he was just messing around and being difficult. And then his roommate, I said, well, if I drop my pills, I'm not coming back, and I don't think your day room's going to like that. And his roommate's like, you better never do that again.
Right.
Because I'm like, I'm not coming back if you're going to do this. So, there are times in what I learned, unfortunately, sometimes for the better and the worse, of how I had to approach things, even with my colleagues, that may not have been the ideal route to take. And so that's when I started learning even more, and that's why I pushed my bachelor's degree, so I could learn more. And I did some management and things, but I am a nurse's nurse. Other nurses are admin nurses. That's what they connect with, and that's what means the most to them is administration.
Right.
But I'm not that way. I'm a nurse. So I advocated for all my staff and my patients when I needed to. Sometimes it became confrontational with the officers, unfortunately, because we have that gap between medical priority and officer priority, which are both very important, but balancing those can be tough, especially with some different personalities.
Oh, yeah.
So over the years, I had to, you got to learn some negotiation and kind of pick your battles. And I had to train nurses to do that because they would get angry at the simplest things. And I'm like, that's not the battle you want to take on with this officer. That's minute. You need to, pick the ones that mean something, not like, oh, you made me leave the pod sooner than I wanted to. I'm like, there's a reason why he did that. But some nurses just can't understand that. And it makes it very difficult for the rest of us that are working in jails with nurses that have no concept or respect for security.
So I get the sense this is the experience of someone that's done the job for a very long time, but there's a transition where I was young, idealistic, and I learned the hard way. Were you the same way?
Oh, yes. With zero trauma experience going into a jail, that was not the best idea. I took the opportunity when I could, but I had none of those skills. I had no emergency skills. I didn't have any leadership skills. And there I went. But thanks to my mentors, it was a productive and a positive atmosphere. It was the management that was making it more difficult.
Oh, so my biggest battles were with management of the police department, not with the bad guys on the street.
No, no, but I was a problem child in the booking area too, I will admit, because I was the one that would medically accept or refuse patients before we would book them in from other jurisdictions.
Right.
And some of them would bring them in. They were, they were blowing .4, and I'm like, I'm not taking him to jail at a .4. So one of the counties decided they would just call booking and find out if I was on duty or not. And then they're like, no, we'll just go over to the ER and then we'll see you, because I knew I was going to deny their patient. I'm like, no.
And we had those challenges
and asked
too.
Me if he could leave the hospital when the doctor's saying no. He had a .5, and the doctor's like, he is not medically stable. And they call me and say, well, you take him anyway. I'm like, no.
Right. No. I get it now. When I was going through that, I didn't, to be honest with you, because it was different mindset, different jobs.
Right.
And one of the things I'm not justifying my behavior. I'm just saying you didn't have to fight him to get in the handcuffs. So I got him in handcuffs. Right. I got him to detention centers, to jail, wherever it might be. And then they're saying, oh, no, you got to take him to the hospital and you got to watch him. Oh, my goodness. I hated hospital details.
And it's hard because, officers don't quite understand that, I had 2 nurses in the entire jail. We had, 500 inmates, so we weren't too big. But I had 2 people there, no doctor. You had to try and call, and we had to page them at that time, and you're lucky if they ever called you. So if you really had a problem going on, even it was kind of borderline ER or stability, we really had no choice but to send them to the ER, because I don't have a doctor to see them or treat them.
Did you have any inkling this is going to be the case before you took this job?
No, I did not. And, no. In retrospect, yes, I probably should have got more training, absolutely. But the amount of education, training, and real life world of dealing with certain people in certain places in their lives, it's not really very comparable to other places. The hospital and correctional unit I worked, they did, because they dealt with most of the homeless people and people that were really down on their luck. So they would see them throughout this hospital. So in this hospital that I worked, in the correctional unit, there was a different respect throughout the hospital for taking care of prisoners.
Oh, it's a different skill set altogether. We're talking with Laura Bulbitz, and she's retired RN, registered nurse. She worked in jails in Colorado and for 28, almost 30 years, and she's now retired, and she is a life coach. The name of her business is 3R Strategic Life Coaching, LLC, and her website is 3rstrategiccoaching.com. This is the Law Enforcement Talk Radio Show. More about her story when we return. Don't go anywhere. We'll be right back. Are you a fan of true crime shows? How about True Crime with a Twist? People that actually investigated crimes, what they did, what they experienced, or trauma survivors. Often crime-based, but not always. Impact on them and what they did to build their lives afterwards. All for free. Just go to our website, letradio.com. It's L as in Lincoln, E as in Edward, T as in Tom, radio.com. letradio.com. You'll find it all there for free. Return conversation with Laura Bulblitz on the Law Enforcement Talk Radio Show. Laura's retired RN in Colorado, and she was a registered nurse in jails, and which we'll talk about in a few moments. And she is now a life coach. The name of her business is 3R Strategic Life Coaching, LLC. The website is 3rstrategiccoaching.com. That's 3rstrategiccoaching.com. Laura, I find part of this fascinating because I have a strict aversion. My wife will tell you. I don't like noise. I don't like unpredictability. I don't like unnecessary trauma. I've been through too much of that in my career. But that's what I think of when I think of jails. And I think of prisons a little bit more stable, but jails can be a real nightmare. Are you in the same position as me where you like predictability? And I hate to use the word control. A lot of people ban it, but I want to control the situation. I don't want too much stimulus. I want quiet.
Yeah, I definitely, I had to learn that in the beginning because it was just, there was just people everywhere, even in the first position I worked in at the jail piece of it. You know, the officers would be wandering around and doing their thing. And, you know, at least I didn't have the inmates walking up to me in the hall, which was a benefit because that was really not appropriate
right.
when I went to the other jail. But, you know, it was, I think, you know, I had luckily I only had one death on my watch in the jail. And it might have been preventable had communication occurred between medical and the officers. And that pretty much devastated me because I specifically asked the officer to go check on this gentleman because he always took his meds, always. And he's like, nah. He just went up there. I just asked somebody, one of the inmates, and I'm like, okay. So I left, and I get down to medical, and on my radio, he's like, Laura, I need you back in the pod. I'm like, for what? He's like, you know what? I'm like, oh, my God. And sure enough, he had hung himself with his laundry knitting, and we did not get him back. No. And I had never dealt with that. You know, prior in my career, I had some, you know, geriatric patients pass away in my clinicals and things, but this was so different. And they knew that he had a lot of stress on him because they just separated him from his friend in the other pod that they thought was causing problems with the rest of the inmates. So they separated them. And this kid couldn't handle it. And, you know, unfortunately, I lost it so much that one of my nurses had to take over for me in dealing with the death process and working with the paramedics and working with the coroner and everything because she had more experience than I did, which I was so thankful for. But you never know what might happen. I mean, with the inmates, depending on where they're at in their lives and what they're dealing with, in a drop of a hat, they can do something very traumatic and kill themselves. And it's not always easy to figure out, you know, you segregate them when they come in. Like our psychology team would talk with them and determine their lethality and then decide where they could house them. But a lot of them, if they really want to kill themselves, they're not going to tell you anything.
There's not a lot you can do to prevent it either.
Yeah.
And I think for me, Laura, and I'm going to ask you in this form of question, part of the most troublesome thing was that you wanted to do something to save a life, to preserve life, do all those things. But when there's so much you can't do, you're ultimately powerless over a lot of these things. And that can be a real struggle in itself. Did you encounter that?
Definitely. I was very frustrated with that officer, and I knew him. It's not like we hadn't worked together for a while. And he knew that inmate very well. And it was frustrating to me that, you know, I'm asking you to do one thing that will take you 30 seconds to go check on him. I'll wait. And he refused to do that. But I have no authority over officers.
Well, that's the powerless part. There's nothing you can do to change that. And so you couldn't prevent this guy from doing what he did. You couldn't make the CEO do what he was supposed to do, what you wanted him to do. But the only thing you can do, and I'm very much aware that this applies to me. The only thing I can do is focus on me and my reaction.
Mm-hmm. Right.
And it's a tough tough pill to swallow.
Even for officers, it's like you have a responsibility to your inmates.
Mm-hmm.
There's different levels of that, but you still are responsible for their safety and their security.
Right.
And balancing that out with other staff is difficult because we all have different priorities and there's different focus. One of my administrators held back an ambulance with a lady to release her from custody before she went to the hospital so the jail didn't have to pay for it. Well, she ended up delivering in the Sally Port.
Right.
So, these are the horrifying things you deal with, and it's like that was administration. That had nothing to do with officers. Our security staff was ready to go. If, she's going to the hospital, we will go. We will figure it out, and we'll go. And she's like, no. And so it's like delivered in the Sally Port.
Right. And by the way, just so you know, the one thing I worried about the most in my police career was delivering a baby. I did not want to do that. There's a lot of things I did not want to do, but I came very close. And I never prayed so much in my life like, please, dear God, let the paramedics get here in time.
Mm-hmm. We were so lucky that the ambulance had her in the ambulance when this happened, but she was ready, unfortunately, but we were very fortunate that they got there in time and had her in there to actually have some expertise at delivering her baby.
One of the things, and by the way, it's a very natural thing, and we talk about it all the time, but it is not natural. My reaction is not natural to it. It is not good. I use the word trauma a few times, and they could be good, they could be bad, they could be life-threatening, they could be deadly, they could be new lives coming in. All that's traumatic stuff, and it has an effect on you. Did that have an effect on you?
Absolutely, because, again, it was another thing I had no control over. I knew what should have been done. As soon as she was having contractions as close as she was, she should have been out of the facility. But you have no control over your administration. They decide for financial reasons what they're going to do or not. But I'm like, it's my nursing license. It's going to come back on me because this was my patient and you stopped her from getting adequate care. So that it is so difficult
it is
to
tough.
Deal with those things.
So let's go into, you're a different person now than you were before you started your nursing career in hospitals. Is that a fair assessment?
Yeah. I'm much more assertive than I used to be, and I will speak up and say things. But I ended up, when I worked at the jail to begin with, I built a rapport with the officers. They knew me, I knew them, and it just, because we talked about things like this might be what happens. This is what we are looking for. Call me if you see this happening or whatever. So we had that interaction, whereas a lot of nurses go in there, think the officers are there to just walk around with them and give them their meds, and they don't do anything else. And I'm like, wow.
It's a little more to the job than that. And by the way,
that's the misunderstanding, of that they do much more than that. They're with these inmates 24 hours a day in their shifts. They know them. They see things. And if they don't feel comfortable reporting things to me that they're concerned about.
We're going with Laura Bolitz. She's a retired registered nurse. She worked in jails. And when we return, we're going to talk about life lessons and how did she jump from the frying pan into the fire and how it affects what she does today. She's a strategic life coach. Her name of her business is 3R Strategic Life Coaching, LLC, and her website is 3rstrategiccoaching.com. It's the Law Enforcement Talk Radio Show. After a short break, we'll be right back. How would you like to improve your health? Let's get healthy. Tips you can use today for free. They don't require any money at all. You can download a free ebook, 15 Tips to Improve Your Health, at lethealthy.com. That's lethealthy.com. Again, it's lethealthy.com, and let's get healthy for free. Return conversation with Laura Bolitz on the Law Enforcement Talk Radio Show. Is a retired registered nurse, worked in jails in Colorado. And she's now retired from nursing. She is a life coach. The name of her business is 3R Strategic Life Coaching, LLC. And her website is 3rstrategiccoaching.com. The 3rstrategiccoaching.com. Laura, got to ask you a question. And this is a statement I make all the time. Number one, in policing in Baltimore, everyone we contacted, we didn't arrest. And of the people we did arrest, the vast majority of them were if it was drugs or alcohol, they wouldn't be in the situation they're in. They're not a threat to you. They're not a threat of violence. There was a few people that made bad choices, had 5 minutes, bad minutes of their life. And then there was a very small percentage that were career criminals. And I say it's the same thing in prison, in jail. Was that your case?
It was, especially working at the number one trauma hospital. We got a lot of the people off the streets. And being able to assess those things in jail versus also in an ER still requires that confidence or the ability of that person feeling comfortable enough to actually tell you the truth. And part of that, it could be life or death for them if they don't tell you the truth. But they're like, the officers are going to arrest me because I swallowed like 5 bags of cocaine. And it's like, well,
we had people die from that.
Yeah, probably.
Yeah, we had people die from those bags exploded and they died.
Yes. And it's that piece of it. And I found with the different areas I worked in, I had officers that were much more connected to people. They would treat the inmates with dignity and respect, and they didn't want to do that confrontation thing.
Right.
They didn't have to.
Right. They
didn't want to push it and get into a fight, whereas the other crew I used to work with at a different jail, that's what they loved that. They would push the envelope all the time because they wanted that adrenaline. And it's like, this is crazy, but they would treat them very badly and unnecessarily. And so I had a whole different culture change when I left that first jail. And it was difficult for me at first because I'm like, well, you know, you're just like acting like their friend or whatever, but they had their confidence and they had done it long enough that they knew where to draw the line and how to work things.
Right.
And it took me a while to really realize that, but I had a sergeant that would go above and beyond to try and get inmates to do what they needed to do. We had some psychiatric patients and they didn't want to take their meds, and it could get very ugly because they were emergency meds and we had to give them.
Right.
So he went above and beyond to talk to that inmate. So we didn't have to go in and have the officers pin him to the floor and all of that. So it was quite a shocker to me when I saw those different cultures. But, I worked with officers all those years, and I always could hear she said this and so said that when they are trying to work through something in their lives. And it's like, who is safe for them to talk to about something that they really need to discuss and work through? It's not a colleague, because everybody in the jail is going to know about it very soon.
Well, you can't
Same
talk about that. What's the old saying?
Therapy.
Loose lips sink ships. And law enforcement and corrections, I never worked corrections, but if you tell people the truth about what's going on with you, that could be career ending.
True.
And you said earlier in the conversation, it was your children and your husband that depended on the benefits. It wasn't just you.
Yeah, exactly.
And that's what people need to be aware of. And by the way, in most police agencies, if you get suspended without pay, your health insurance stops immediately. So if you have like 5 kids and you got no health insurance, all of a sudden it's catastrophic. It could be for a week, could be for a month, could be for 3 months.
Exactly. And there are ways to, if you can talk to somebody and actually work through yourself. It's not like as a coach, I don't tell you what to do. I don't tell you, what you should or shouldn't do, eat or not, whatever. We talk about trying to prevent some of that emotional blow up.
Oh, that takes forever.
It's there for everybody.
That takes forever to overcome. I got to go back very quickly. In our notes, it said you became burned out. Would you describe yourself as being burned out from being an RN or being burned out from being an RN in jail?
I mean, just as an RN in general, I think, but our administration at the facility was extremely difficult at the time. And we had my mother-in-law passed away the year before. My grandmother passed away before that. So there was other, personal trauma things too I was working through with my family as well. But the lack of support from administration did not help my matters any, and I decided, I just can't do this anymore. I don't have the energy. I don't have the desire or the passion to take care of people like I used to. And I was being more difficult than normal with everybody. And I'm like, this isn't working. And it took me to now, 3 years later, to actually find another path.
Well, and here's a good question, because, and I'm just going to personalize this. I used to have a saying I would say all the time to people: hire a therapist. They're paid to listen to your stuff. I'm not. The last thing I want to do is listen to people complain about what's going on in their life. And I know I'm oversimplifying it, but I find, again, I have very little chill when it comes to that. Are you that way?
I can be that way, but not in this role that I've I've acquired, because it's now more of trying to change that person's focus when you're talking to them as to why do you feel this way? And it takes it into a deeper level of, why is this really causing you this distress? So, so they talk through that and they're like, oh, well, yeah, I guess I have directed my frustration in the wrong direction. I had that with a student I work with that was mad at her children for taking them to their soccer games.
Right.
But as we talked,
that's what kids do.
She finally put the pieces together with her husband because he was making her schedule for her.
There you go.
And then it dawned on her. She's like, I'm frustrated with him. I'm like, yeah.
Here's a statement on my part, Laura. I'm not big on life coaches. However, I think if I was going to hire one, I would hire you.
Yeah, I am definitely not here to give you a goal, make you have a goal. I'm here to try and help you work through whatever you need to work through, or if there's a goal you want to get to that you don't want to explode 2 times a day. How do I get there? I want to feel better. I need, I'm burnt out. I need something. And we can talk through those things and provide, sometimes it's the fluffy stuff, as they call it, with a meditation and whatever, but it does help calm the mind.
I'm a big advocate of prayer and meditation. I do that daily. Mm-hmm. And it's really, and I hate to use this overused phrase, it calms a savage beast in me. It really does.
Mm-hmm. Yeah.
And I don't think it's foo-foo at all. I don't think it's woo-woo at all. Very quickly, you transitioned from nursing to this, and your website is 3rstrategiccoaching.com. Can people get more details about you, what you do, contact you there?
Absolutely. It kind of explains things, because nurse coaching is kind of a misnomer. People think we train coaches. We don't. That's not what that means, but it's very confusing. So the site explains that a little bit more, and there is a free download. If you stick in your email, you get a download for a free How to Manage Stress little pamphlet that has some of the exercises in it that can be done in the positions that officers work. Very simple, very subtle things to try and reset. So that's offered in there as well. And my about story isn't much in there because, really what I'm doing right now is not about me.
Right.
It's about who I want to help.
I would strongly suggest that maybe you want to expand that a little bit, because you're a wealth of experience that would have a huge impact. And very quickly, we're almost out of time. Is most of your practice working with corrections officers and police officers?
My whole business is based on focusing on correctional professionals, law enforcement. I'll work with the medical staff as well too, but the things I've kind of put together were more focused at officers. I have a program that's like a 6-week thing that we kind of go through burnout and emotional triggers.
And on that note, we got to cut things off. We are out of time. Laura, thanks for your service, and thanks for being a guest on the Law Enforcement Talk Radio Show. Both very much appreciated.
Thank you so much for having me.
Of all the radio stations in the United States, there are no other shows like the Law Enforcement Talk Radio Show. And on Facebook, there's only one official page. Do a search on Facebook for the Law Enforcement Talk Radio Show. And be sure to like the Law Enforcement Talk Radio Show Facebook page. I'd like to thank our guests for coming on the Law Enforcement Talk Radio Show. The Law Enforcement Talk Radio Show is a nationally syndicated weekly radio show broadcast on numerous AM and FM radio stations across the country. We're always adding more affiliate stations. If you enjoyed the podcast version of the show, which is always free, please do me a favor and tell a friend or two or three. I'll be back in just a few days with another episode of the Law Enforcement Talk Radio Show and podcast. Until then, this is John J. Wiley. See ya.
If you like the show, please take a moment to rate, review, and subscribe. It really does help the show to grow. Thank you for listening.